it is going to be basic, but I want you to kind of keep an open mind about everything, because as speech therapists, we'll find this test a little bit ridiculous. But we have to keep doing it, so that it is valid. So we have to do it as a standardized assessment. We can't change anything. We can't do anything different. And so I know that, a lot of this is review, but there are some things that we forget. And I've just been monitoring everybody's BIMS, and so I thought we would go over this. So, first quick thing, of course, the SLP component of PDPM uses 5 characteristics. Acute neurological, you guys have heard me, seen me email you about those diagnoses. And then SLP related comorbidities, which you guys are also getting emails about. Presence of a cognitive impairment, which is what the BIMS is showing. Just know that the Cleveland Clinic reports that this is not a test for mild impairment. It only shows mod to severe impairment. So if we have somebody with a mild impairment and we're not showing it on the BIMS, we do need to do something else to show that. Of course, the use of a mechanically altered diet and the presence of a swallowing disorder. And this is a big part of the PDPM. And as I've been monitoring these things, I've noticed that we, sometimes I'm monitoring them to our detriment, right? Like we're not picking up everything that they are catching, or that we catch it, but we can't, put it on the eval, or we can't capture it for MDS. And so what I'm trying to do, though, is make us a little bit better. So what MDS captures, we have that everything is the same, like we're matching. A lot of the times, we've done all this work and we get there, we give them our sheets, and then they're like, we can't capture anything. And that's where all of this has come from. So it's not that we're not doing a great job, with everything, but we do have to make sure that we're doing it in a fashion that everybody can count it. And of course, this is a chart. We'll probably do more about this on the Section K. I know you guys see this a lot. It does, increase the amount of payment based on how severe a person is. And so you guys are having to do this on your sheets, and that's a whole lot of fun, right? Cognitive status. So residents' cognitive status is assessed only for MDS with the brief interview for mental status, the BIMS. In cases where the BIMS cannot be completed, the providers are required to perform a staff assessment for mental status. And so on our part, when the BIMS cannot be completed, we must communicate this to the program manager and the social worker. They are the ones who do the staff assessment. And if we don't get it to them in time, of course, they need time to do that assessment. So, we're usually doing our eval within day 1 or day 2. We should know this, and this should be communicated to social workers pretty quickly. And they'll do the staff assessment for mental status. So a cognitive impairment is 12 or less. And of course, anything that is 13, 14, or 15, we should have another assessment. So if it's below 12, you don't necessarily need another assessment unless you want to figure out what's going, what else are the problems. Because the BIMS, of course, only touches a couple things. And so I usually do the slums. Some people do the MOCA. There are other tests that can be done, but if you have a 12, you don't necessarily have to do another test. If you have a 13, 14, or 15, it would be great, because we're saying they're normal, to actually show if they have a cognitive impairment. And one of the reasons I say that is because then we have somebody who's supposed to be going home. PT is saying they can't follow directions, they can't do anything with us, they're not, remembering the precautions, and we said that they were fine. And so I know once we do a slums or something else, that's going to open up another little can of worms. And look, lo and behold, they do have a cognitive impairment. And then the problem is that then they're an SA or something and we want to see them. So, but we just have to have that documentation that they do have a cognitive impairment in our notes, for safety purposes. And if we want to do therapy, to have that for therapy purposes. But if they have a 12 or less, you don't necessarily have to do anything else. But it is good to have something on board, kind of, more mental flexibility where they're having problems. The BIMS is very limited. All right, who administers the BIMS? Anybody can do this test, but mostly it's been social workers in the facilities. And then when PDPM started, of course, they wanted us to do it speech or OT, because we, do great at standardized assessments. That is what we do, sometimes to the detriment of this test, because it doesn't make as much sense as a, different standardized assessment would. But with, PDPM, this is super important. Not just knowing like where they are in payment, but also like, can they go home, and if they get a low score on the BIMS, they're fairly cognitively impaired. So the MDS and the RAI, all of, this is driven by the RAI manual for the MDS, and that's how the facility gets paid. The BIMS is part of a federally mandated comprehensive assessment. I hope in the future that changes and they pick something else. But right now, this is it. And it's completed on all Medicare and Medicaid certified nursing homes. So everybody has to get this long-term, short-term. You guys have been seeing that we've been doing it on pretty much anybody. This comprehensive assessment is named the MDS, or the minimum data set. And the RAI manual, resident assessment instrument, provides the instruction for completing the MDS assessment. So everything has to be done just right. It is mandated that it's done this particular way. When Myers and Stoffers come in, they're the people who make sure that everything's done right, to see that you guys have captured everything or not captured everything. We are getting some things saying that we're not doing things right. Like when they come back, it still counts against us. So we want to make sure that for our customer, Century Care, that we are doing everything we can to be correct. Because if, they put something incorrect in the MDS, then, and there's an audit, then they can, it does count against them, even if it was to, their betterment. So let's say, something wasn't done enough. We didn't, capture something and we could have captured it. That still does count against us. But of course we want to capture everything. And so I'm not going to go into this a whole bunch, but section C is cognitive assessment. You guys should be going in there, some sort of speech therapist going into section C and signing in there. I know that's a little bit weird. We put everything in PCC, but somebody also should be signing it. And I know we've had some issues with that, but we'll talk about our paper copy too when we're done, and the importance of having a signature on that too. So information on the MDS comes from documentation. The chart documentation must be entered accurately and timely to be used on the MDS assessment. The assessment, where the days are days 1 through 8. So we'll talk about that in a little bit. The admission MDS can be scheduled between day 1 and day 8. Sometimes they'll do day 7 to capture things on the first day. Some buildings do the 8th day. We just need to make sure that we know so that we do the BIMS properly at the right time. The BIMS score can only be used if it's within a 7-day window to the MDS. So that's called the ARD. And so if we do it on day 1 and they use day 8, it won't count. So, we need to make sure that we are, assessing them at a time where it will be captured. The earlier that you get in there, they may be more confused. They may be more confused on day one. So we pick day one. That is up to you and the MDS coordinator. If that is the case, that's a conversation to be had. You give them a couple days and they know where they are and what's been happening, and they've been educated, and, they're going to do better. They're going to know more about orientation and what's going on. So think about that when you guys do your speech evals. You do want to catch them at their worst, and you want to be able to capture all that information. And if they are declining at certain times a day, and we had one and we got a 13 on it, and he's declining a little bit later, we may want to, do one in the late afternoon to make sure that we capture who this person is at all times of day. Because those later times of day when they're confused are going to be expensive for the facility. He's going to be falling. He's going to need a sitter. He's going to, need more care. And that is what this is about. How much care does a resident need? So anyway, the managers usually do, every building picks a different day, but that's something you guys might want to talk about a little bit more. When multiple BIMS are administered during the 7-day window, the one closest to the MDS assessment date must be used. So if we have multiple people, and not in this building, but in one of my other buildings that I used to have, we had multiple people doing it. And we had to use the one that was closest to the MDS assessment date. And sometimes that one was showing that they were normal. So please be careful. I think we are pretty good at all Century Care buildings, so that's wonderful. But if somebody's going to give another one, we need to make sure that they're going to probably do worse, have a conversation about it, definitely, because we don't want to capture, when they came in, they were a 12. On day 6, somebody gives another one and they're a 15, number one, they probably learned the test a little bit. Number two, they're more oriented. They've, been in therapy. Therapists have been, talking about, days of the week and where they're going and what their schedule is. And, so they're becoming more knowledgeable as the time goes on, as they should. So for an example, 2 BIMS were administered. Day 2, BIMS administered with a score of cognitively impaired. Day 6, it's cognitively intact. MDS must use the BIMS given on day 6. So just be careful. I haven't heard that any of that has been happening. So, but we may want to do another BIMS. They may decline and we may want to capture that. All right, administration and scoring. This is the fun part. Can you guys see my screen of the BIMS with the signature line? Anybody? I can't see anybody.
Yeah, it's there.
Okay. So make sure that I'm doing all of this in on the internet. So but on our website, under employees, under orientation documents and links, there is, and hopefully you guys are still seeing this, all the training documents at the bottom. This PDF is here. Also, the BIMS with the signature line is here. All sorts of Section K stuff, commonly used ICD-10s, everything is here. So all the stuff that we, share goes on here. This video will be on the CTS YouTube link. So just know once it's done and I get it to Brad, and I've watched videos about how to do that. So hopefully I'll do okay. But make sure we're doing the one with the signature line. As they're doing audits, what we are noticing is that sometimes some places, the MDS gets signed by somebody different, the BIMS gets put in there. Just make sure we have a signature on ours and a date, because this can be our backup. I would also, when we scan these in, and most of you guys on my side are scanning them to me, When you do that, go ahead and attach them to their case manager as an attachment. That way we have it if I ever need to go in and look at it, which I've had to at some times, there's been a question or whatever. It's always good to have that. But this has definitely been a good backup. I know a lot of people are keeping paper copies. I would just scan it in and attach. So, all right. I've been noticing that we've been using different forms. I've been trying to let everybody know that, but just company-wide, let's use the one that has a signature line on it. So this is what it looks like. I'm sure everybody can see it in their sleep, and probably sock blue bed all the time, and dreaming. But I know that some of this is going to seem really redundant, kind of childlike. This is a different test. It has very different rules and standardization. And we have to do it exactly the way they say. We have to do it in the resident's preferred language. If they need or want an interpreter, we have to do an interpreter, which I know you guys watched that wonderful video about interpreting. But we do need to make sure that if that is the preferred language, that it's done in that preferred language. I know that I had a little lady that I used to do it with on the telephone with the interpreter. I think we did it like 3 or 4 times. She kept going in and out of the hospital. One thing I had to tell them, the interpreter at the time, was to say it the way I say it. Don't give them any extra cues, because there was a time where I could tell, I don't speak a lot of Spanish, but I could tell that he was giving her more information than what I gave. So make sure that we at least, educate the interpreter that they can only say what we say, or in a way, they can't give them any more information. It does make the test non-valid. So, and then anyone who uses ASL would also need an interpreter, if that's the case. Possibly they can read, so we can do it that way too. If the resident appears unable to communicate, offer alternatives such as writing, pointing, sign language, or cue cards. Earlier, I had some cue cards up here. I just typed in BIMS cue cards, and it came up with it. I mean, there's hundreds of them. So don't reinvent the wheel. Just go out and look them up. Maybe save the website on your laptop so that you guys have them, and you can show them directly from your screen if needed. But that's probably the easiest way to do that, because they, they're everywhere. Like, don't even make any more than you need to. All right, so be sure they can hear you and has access to their preferred method of communication. I know CenturyCare has gone over that quite a bit, and we have to do it every year. Residents with hearing impairment should be tested. We should be checking their hearing aids and making sure that they are working before we do this. And if we need to, headphones or hearing amplifier, some external assistive device may be necessary. Every facility should have some sort of amplification system. If you're having to yell at them, as you walk in the room, I would go ahead and get it, try it out, see if it works, because we have to prove that we did everything we could to make it, easily accessible for them. And then, of course, shut the door, go into a quiet place. If the roommate has a TV on, request that the TV gets turned off, because it's not fair to assess somebody's cognition if there's a lot of background noise. All right, C0100. Should the brief interview for mental status be conducted? This is a yes or no question, and these are the guidelines. So you interact with the resident using his or her preferred language. Determine if the resident is rarely or never understood verbally, in writing, or using another method. If the resident needs or wants an interpreter, have an interpreter. And if The interview, if you feel that you need to code 0, that means the interview should not be conducted because the resident is rarely to never understood, cannot respond verbally, in writing, or using another method, or an interpreter is needed but not available. That last one, interpreter is needed and not available, that's a, go to the administrator kind of thing. So I definitely wouldn't code a 0 just for that without trying some other methods. If that's the case and we code 0, the program manager and the social worker need to know ASAP so they can complete that other assessment. If we code 1 for yes, then, we're saying that it can be conducted because the resident is at least sometimes understood verbally, in writing, or using another method, or if an interpreter is needed, one is available. So, and one, if you code a 0, that should be it. There should be nothing else on the page except the 99, handed in. Okay. If that's the case, we just have to make sure that they can't do it in writing or read it. Sometimes we forget about that because it's just not as easy, as coming in there verbally, but everybody has a laptop. So, type in BIMS cue cards and they'll save you every time. And there's lots of them. The one that's on this PowerPoint, the link does not work. Otherwise, I would have you use it. All right, so additional interview guidelines. In addition to guidelines for C0100, directly ask the resident each item in C0200 through C0400 at one sitting and in the order provided. We cannot stop the test. Once we go, we have to just continue to go. If we notice that they are not getting the answers or there's nonsensical things or we're having breakdown, we'll talk about that in a little bit. But we have got to do it all at one time. If the resident chooses not to answer a particular item, accept his or her refusal and move on to the next question. And you code from 200 to 400, you code refusals as incorrect. Coding nonsensical responses. Definition of nonsensical response: any response that is unrelated, incomprehensible, or incoherent. It is not informative with respect to the item being rated. Nonsensical responses should be coded as 0. Practice scoring. So we're going to give you an example. Question 1. The year is 2019. The interviewer asks the resident to state the year. The resident replies that it's 1935. This answer is incorrect, but related to the question. Coding this answer, the answer is coded 0, incorrect, but would not be considered nonsensical. Rationale is the answer is wrong, but it's logical and relates to the question. So that one's pretty easy. Nothing out of the ordinary. Number 2, interviewer asks the resident to name the day of the week. Resident answers, Sylvia, she's my daughter. How would you code this? Coding the answer is coded 0, incorrect. The response is illogical and nonsensical. The rationale for this is the answer is wrong, and the resident's comment clearly does not relate to the question. It is nonsensical. So we always code those as incorrect. When to stop the interview. You're going to stop the interview after completing C0300. So after temporal orientation, right here, if all responses have been nonsensical, any response is unrelated, incomprehensible, incoherent, non-informative with respect to the item being rated, or there has been no verbal or written response to any of the questions up to this point. If there has been no verbal or written response to some questions up to this point, and for all others, the resident is given or there has been no verbal or written response to some questions up to this point, and for all others, the resident has given a nonsensical response. Sorry, that didn't sound right. If the interview is stopped, you have to do the following. So you code a dash in C0400A, B, and C, and code a 99 in the summary score. So if you are, going along and you get through 300 and they're all been nonsensical, all the other ones have to be a dash in order to code 99. And then, of course, you have to notify the program manager and the social worker. They can't all be zeros and then a 99 because that seems like they just either tried to respond, just didn't get it right. So if we are really struggling with them and it's going to be a 99, we have to put those dashes in. All right. Introduction before starting the BIMS. Of course, you're going to tell them who you are, give an introduction. Suggested language is I would like to ask you some questions. We ask everyone the same questions. This will help us provide you with better care. Some of the questions may seem very easy, while some others may seem more difficult or may be more difficult. If the resident expresses concern that you are testing his or her memory, which we get a lot, he or she may be more comfortable if you reply, we ask these questions of everyone so we can make sure that our care will meet your needs. And just wait until after you do this one and then you do the slums. They're so excited. So repetition of 3 words, CO 200. You're going to ask the resident the question on the handout. So, I'm going to say 3 words for you to remember. Please repeat the words after I have said all 3. The words are sock, blue, and bed. Now tell me the 3 words. I know you guys can say that in your sleep. Score words repeated after first attempt. That's it. We don't give them any other. It's just first attempt, what they said. That's when you score it. You can write it next to there so that you have some idea of what they said. After resident's first attempt, you can repeat the word using category cues, but they will not count. So after resident's first attempt to repeat the items, if the resident correctly states all words, say, that's right, the words are sock, something to wear, blue, a color, and bed, a piece of furniture. So we have to give the category cues. I have seen people who don't do this. This is part of the test. If the resident recalled 2 or fewer words, say to the resident, let me say the 3 words again. They are sock, something to wear, blue, a color, and bed, a piece of furniture. Now tell me the 3 words. If the resident still does not recall all 3 words correctly, you may repeat the words and the category cues 1 more time. So that's the 3 times that they get. We don't want to just keep going and going and going. Some of us, we're like, oh, they didn't know them. Let's keep moving on. We actually have to give category cues. So they have to, that way when we cue them later, we have something to cue for. I've had some CFs that had some trouble with this. So that's what I'm basing it on. All right, does not repeat all 3 words after 3 attempts. If the resident does not repeat all 3 words after the 3 attempts, reassess ability to hear. If the resident can hear, move on to the next question. If he or she is unable to hear, attempt to maximize hearing, alter environment using hearing amplification before proceeding. As speech therapists, I think we're pretty good at this, or, we're walking in and yelling at them and screaming to the top of our lungs. We're definitely not going to do a standardized assessment without some, amplification. But, you may notice that they did really good, just conversation, because it was, rote conversational tasks. But as we get into something a little bit more harder, they're having more difficulty, you may want to try amplification. But remember too that you're supposed to do this whole test all the way through. So anyway, take that with what you may. Hopefully you have the amplification with you and can apply it. So maybe a kit, everybody has one, in their kit, and their carts or whatever. Record the maximum number of words that the resident correctly repeated on the first attempt. This will be any number between 0 and 3. The words may All right, somebody's entering. The words may be recalled in any order and in any context. For example, if the words are repeated back in a sentence, they would be recounted as repeating the words. Do not score the number of repeated words on the second or third attempt. These attempts help with learning the item, but only the number correct on the first attempt go into the total score. Do not record the number of attempts that the resident needed to complete. Most of us move on after, after the 3. So code 0, if the resident did not repeat any of the 3 words on the first attempt, it would be 0. It would be a 1 if the resident repeated only one of the words on the first attempt, 2 if they repeated 2 of the 3 words on the first attempt, and 3 if the resident repeated all 3 words on the first attempt. So here's another example for C0200. The interviewer says the words are sock, blue, and bed. Now please tell me the 3 words. The resident replies, sock, bed, black. The interviewer repeats the 3 words plus the category cue saying, let me say the words again, the 3 words again. They are sock, something to wear, blue, a color, and bed, a piece of furniture. Now tell me the 3 words. The resident says, oh yes, that's right, sock, blue, bed. What would you code? And hopefully you guys all said you would code 2 of the 3 words correct on the first attempt. And so we just, make sure that it's just the first attempt, which I don't think any of you guys are having any trouble with that. All right. Example number 2, the interviewer says the words are sock, blue, and bed. Now please tell me the 3 words. The resident says blue socks belong in the dresser. The interviewer repeats the 3 words plus the category cues. What would you code? Dun, 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 dun. It would be 2. 2 of the 3 words are correct. And the resident repeated 2 of the 3 items, blue and sock. The resident put the words into a sentence, resulting in the resident repeating 2 of the 3 words. So the reason they give this one is because they give some more, like at the end, more examples that are not correct. So. And then example number 3, the interviewer says the words are sock, blue, and bed. Now please tell me the 3 words. The resident replies, what were those 3 words? The interviewer repeats the 3 words plus the category cues, and you would code a 0 because the resident did not repeat any of the 3 words after the first time. So if you repeat them at all, it is considered a 0. All right, temporal orientation. So on the C0300, you're going to say, please tell me what year it is right now, what month, what day of the week. So you're going to ask each of the 3 questions separately. Allow the residents up to 30 seconds for each answer and do not provide clues. So this is where people get really frustrated because 30 seconds is a long time. I was reading some things about it and they said a stopwatch would be good. And, I have like 3 in my car. So if any speeches want a stopwatch, I can give those to you. There are other things in here that, it's 5 seconds. So anyway, but the biggest part is to sit there and stare at them and not provide any clues, which I think is where some people, have a hard time with this one. If the resident specifically asks for clues, is it bingo day? Respond by saying, I need to know if you can answer this question without any help from me. So we're supposed to give them time and no clues, and then we sit and stare at them for 30 seconds. So just warning you guys that I don't know that everybody's doing that amount of time. I think we do just move on fairly quickly. So including myself, it gets a little boring. All right, able to report the correct year. Code 0 if missed by greater than 5 years or no answer. The resident answer is incorrect or is greater than 5 years from the current year, or the resident chooses not to answer the item. So there are some people who choose not to. It is incorrect. Code 1 if missed by 2 to 5 years. And this is where we really need to write the answer down and go back and kind of look at it and not try to calculate the BIMS while we are giving it. If the resident's answer is incorrect within 2 to 5 years from the current year. So, we're giving them every chance to get a good score. And then you code 2, if missed by 1 year, the resident's answer is incorrect and within 1 year from the current year. And then code 3, correct if the resident states the correct year. Note, the only correct answer is the exact year. For example, the resident must say 2011 and not 11. So one of the things I've been noticing on the BIMS that I look at, it'll say 25. I don't know if that we just wrote that because it's, our note, or if that's actually what it was. If they just said 25, it is incorrect. I do usually ask, can you say the whole year? So I know that they can, but I don't score it correctly. It is an incorrect answer. So just so you guys know, make sure that that one is being followed. The date of the interview, so this is an example. The date of the interview is June 16th, 2011. The resident responding to the statement, please tell me what year it is right now, states that it is 2007. All right, you would code this a 1 because it's missed by 2 to 5 years. So as speech therapists, this one's really tough for us. It's either right or it's wrong. But here, if it's within 2 to 5 years, they do get partial credit. So, just making sure that we are remembering that we are giving them that benefit of the doubt and, calculating those things. The rationale is that 2007 is within 2 to 5 years of 2011. So whether this is right or wrong doesn't matter. This is how the test is done. So just keep that in mind. Correct month. So count the current day as day 1 when determining whether the response was accurate within 5 days or missed by 6 days to 1 month. Code 0, missed by greater than 1 month or no answer if the resident answer is incorrect by more than 1 month, which seems like a lot, or if the resident chooses not to answer the item. Code 1, missed by 6 days to 1 month if the resident's answer is accurate within 6 days to 1 month. And code 2, accurate within 5 days. If the resident's answer is accurate within 5 days, count current date as 1. Current date as day 1. So we're going to do some of these. These are, I don't know, as the speech in me really gets a little upset about these. So just going to say, in most instances, it will be immediately obvious which code to select. In some cases, you may need to write the resident's response in the margin and go back later to count the days if you are unsure whether the date given is within 5 days. All right, here's an example. The date of interview is June 28, 2011. The resident is responding to the question, what month are we in right now? States that it is July. So the answer is 2, accurate within 5 days. The resident correctly stated the month within 5 days, even though the correct month is June 28th, day 1, plus 4 more days is July 2nd. So July is within 5 days of the interview. So take this for what it is and just know that, calculations, you may have to go and calculate a little bit later, look at the calendar, count the days. Are there 30 days, 31 days in the month? Yeah. All right. Number 2, the date of the interview is June 25th, 2011. The resident responding to the question, what month are we in right now, states that it is July. And what would you code this? It would be coded 1, missed by 6 days to 1 month. The resident missed the correct month by 6 days. So June 25th, day 1, plus 5 more days, June 30th. Therefore, the resident's answer is incorrect within 6 days to 1 month. Yes, I know. All right, day of the week. coding instructions. 0, incorrect or no answer. If the answer is incorrect or the resident chooses not to answer the item, and code 1 if the answer is correct. So the example is, the day of the interview is Monday 25th, 2011. The interviewer asks, what day of the week is it today? The resident responds, it's Monday. What would you code it? Ding, ding, ding. It would code it 1 because it is correct. The date of the interview is Monday, June 25th, 2011. The resident responding to the question, what day of the week is it today, states, today is a good day. You're going to code that 0. It is not a nonsensical response, but it is not correct. So it would be 0. All right. Hold on a second. I don't know where my... Any questions? Do we have any questions from anybody? Anything that you guys are questioning or loving or hating about it? Okay. We'll open to more questions in a little while too. I know this is the most boring stuff, so I'm going to go through it. All right. Recall. So this is where you go back to the previous C0100 and C0200. Ask the resident the following. Let's go back to the earlier question. What were those 3 words I asked you to repeat? According to everything I read, you have to allow 5 seconds for spontaneous recall of each word. If it's less than 5 seconds and we move on, it is not given properly. For any word that is not correctly recalled after 5 seconds, provide a category cue. Category cue should be used only after the resident is unable to recall 1 or more of the 3 words. Allow up to 5 seconds after category cueing for each missed word to be recalled. And when I was doing some research, they were like, you should have a stopwatch. So if you guys want one, let me know. I know most of us do this in our sleep, but just, for kicks and giggles, sometimes we probably rush through a little bit quick. For each of the 3 words, the resident is asked to remember. You code 0, no or could not recall. They can't recall the word even after being given the category cue, or if the resident responds with a nonsensical answer or chooses not to answer the item. You're going to code it as 0. A 1 after after cueing, they require a category cue to remember the word. Code 2, yes, no cueing required if the resident correctly remembers the word spontaneously without cueing. All right. If on the first try without cueing, the resident names multiple items in a category, one of which is correct, they should be coded as correct for that item. If, however, the interviewer gives the resident the cue and the resident then names multiple items in that category, the item is coded as could not recall, even if the correct item was in the list. So this is kind of difficult to remember as we're there, everything's happening. We just have to make sure that, and this is the part that, every time I look at this, I'm like, oh yeah. That, they can say it in a list of items and it does not count. And they're going to give you some examples of this. So the resident is asked to recall the 3 words. The resident replies sock, shoes, and bed. The examiner then cues 1 word was a color. The resident says, oh, the shoes were blue. What would you code? Sock would be coded 2, yes, no cue required. Rationale, the resident's initial response to the question included sock. He is given credit for this response, even though he also listed another item in the category, shoes, because he was answering the initial question without cueing. Blue would be coded as 1, yes, after cueing. Rationale, the resident did not recall spontaneously, but did recall after the category cue was given. Responses that include the word in a sentence are acceptable. So just so you know. And then bed would be coded 2, yes, no cued required. Rationale, the resident independently recalled the item on the first attempt. All right, they're going to give you a second one that's going to be very different. So the resident is asked to recall the 3 words. The resident says, I don't remember. The assessor then says, one word has something to wear. The resident says, hat, shirt, pants, socks, shoe, belt. How would you code? And this would be, sock would be coded as 0, that they could not recall. After getting the category Q, the resident named more than one item, a laundry list of items, in the category. The resident's response is coded as incorrect, even though one of the items was correct, because the resident did not demonstrate recall and likely named the item by chance. So, all right, here's the summary. We're almost done. So C0500 BIM summary score after completing C0200 to C0400, you add up the values. Do not add up the score while you're interviewing with the resident. Instead, focus your full attention on the interview. Part of that is, like we talked about, the calendar days. Part of that is, some of the responses you may think are right when you think about, back at them, you're like, I don't know. So I know it's easy to go through and just be like, oh yeah, but with all the different coding, I definitely would say, to try to step out of that and look at the dates really carefully. Enter the total score as a two-digit number. The total possible BIM score ranges from 0, 0 to 1, 5, so 15. If the resident chooses not to answer a specific question or questions, that question is coded as incorrect and the item counts in the total score. If, however, the resident chooses not to answer 4 or more items, then the interview is coded as incomplete and a staff assessment is completed. So just know that if there are 4 or more items that they are choosing not to do, that we do need to say that that is a 99 and notify PM and social worker. All right. Code a 99 if unable to complete interview if the resident chooses not to participate in the BIMS. If 4 or more items were coded 0 because the resident chose not to answer or gave nonsensical responses, or if any of the BIM items were coded with a dash. A 0 score does not mean the BIMS was incomplete. To be incomplete, a resident had to choose not to answer or give completely unrelated nonsensical responses to 4 or more items. So somebody can be, get a 0 for every item because they have tried but answered everything incorrectly. So they're very different scores. 0, 0, and 99 are very different. We got to make sure that we're coding those correctly. All right, coding tips. Occasionally, a resident cannot communicate but can communicate but chooses not to participate in the BIMS and therefore does not attempt any of the items in the section. This would be considered an incomplete interview. Enter 99 for C0500. And then, of course, notify program manager and social worker. And so they scored all the things from above, and the score would have been 12, which would have been a cognitive deficit. So, which we know is actually probably moderate to severe, right? If they show a deficit on here, it's not going to be a minimal one. These cue cards did not work. So if you guys want me to send you the cue cards that I had up earlier and forgot to put on here, but if you just, and then Brad and Donna and Stacy, sad. If you guys, just go on the internet and just type in BIMS cue cards, there are some that have like the entire test, the PHQ9, everything, which is really nice to have with you. You can print those out or have them on your screen. And one of the reasons I wanted to do this is just so that we remember all it seems like a very easy test, but there are a lot of rules for the test. We have to keep it standardized when we do the test. And also, I wanted the managers on here who maybe don't give the test often to have a refresher, because it's pretty important that you guys are looking at the tests and saying, okay, does this look right? If you see a 26 on there instead of a 2026, that you can um go to your speech and say, hey, this says 25, are you sure that this one's right? If it says 0 next to there, then you're fine. But you guys need to also be able to spot check these and make sure that they are as accurate as possible. So I know a lot of my people are sending them to me. I am inundated with a lot of them. So, some of them I don't get to, which can be sad because by the time I look at them, it's like, we could have changed some things. But I do want just to educate everybody so that we have a better opportunity to capture who these people really are. And, I would definitely say, if you see a patient with a 13 through a 15, another assessment would probably be a good idea so that we have people who, if we are seeing them and they are an SA or an SD, that we, have some backup, why, but also for planning to go home. They should have some more information. About really what is going on. Because at some buildings, we've had issues where, speech isn't seeing them. We say they're normal off the BIMS, but they're really not. So we need to make sure we know who those people are. And I don't want to say that we're seeing them 5 days a week or anything like that, but that we are assessing those even mild things that may keep them from going home safely. So any questions, concerns? This went over a little bit over an hour, so I apologize. It's not fun stuff.
Christy, I have a question.
Sure.
We have some long-term patients that as soon as we say, we have 5 words for you to remember, they'll say, oh, is it sock blue bed? So they've committed it to long-term memory. Do you have a suggestion on how we should handle that as far as scoring on the BIMS?
No, unfortunately, by using this for everybody at all times, people are going to remember it. But if we are going to pick them up for therapy and we think that they have something going on and we're going to address that, I would give them something else too. If we're just assessing them for the facility and, there's nothing we can do about that. So.
Okay. Something I've done, and I'm not sure if it's correct, is I will give them 3 other words like shirt, yellow, chair. Is that allowed or should I stop doing that?
What I would do is give the full assessment as the BIMS as it should be, right? They want you to give the full thing through, and then you can do things like that. Those are criterion referenced things that you can do to, assess whether that was an accurate reading or, they may not be good for the slums.
Yes.
They may not be able to do the 5 words, and the clock drawing and things like that, but that something's probably off a little bit. They've just memorized it. So I would give the BIMS in full as it's supposed to be, and then after that, maybe do something like that.
Okay, thank you. That helps.
You're welcome. Any other questions?